Where I work in South London, colleagues have been doing a lot of work in recent years, trying to understand the reasons why people struggle to engage in care and what we need to do to support them to come back. And as you've highlighted, the world of HIV nowadays is so different than it was even just a few years ago, and certainly in the early days of the epidemics. We have such amazing treatments where most people are taking one tablet once a day, no side effects, completely well, living long, normal, healthy lives, and can be 100% confident that they will not transmit the virus to their partners. But even with those very strong messages, it is still sometimes a real struggle for some people to engage in care. There are lots of different reasons for that. It can be related to other life pressures, to poverty, to unstable housing, to just having kids and life and money struggles, mental health problems, drug and alcohol problems. But I would say that probably, and I'm sure we're going to talk about this some more later, the single biggest thing is HIV stigma. It underpins everything, and the stigmatizing approaches still in society and how individuals can sometimes stigmatize themselves means that they struggle to come into care. And we know actually now that there are more people living with HIV in this country who know about their diagnosis but are not accessing good healthcare than there are who are undiagnosed with HIV. It's estimated to be maybe between 5,000 and 15,000 people. So our recent work has been to really kind of refocus a lot of our efforts, not to stop testing and not to stop focusing on treatment, but to really to think about what are the reasons why people struggle to come into care and how can we support them. And there are a number of things, but they often involve social support as much as medical treatments. And you mentioned the important role of voluntary sector organisations and the really important role of peer counsellors and peer support. I would certainly say that it's a multifactorial approach, but probably the single biggest thing that makes a difference, certainly in the clinic that I work in, is the work that peer support workers, so people living with HIV who are experts by lived experience, who can connect with people sometimes a lot better than we can as doctors and nurses.